Hello, my name is Fiorella Malpartida McKnight, and in this video I'm going to show you different treatments to manage your osteoarthritis at home. I will go over some joint protection techniques, non-drug pain relief, and exercise, so let's get to it. But first, what is osteoarthritis? Osteoarthritis is the most common type of arthritis, described as inflammation of the joints. This condition can occur from different reasons. Some include trauma, overuse, genetic factors, or age. Changes in the joint may result in degeneration or breakdown of the cartilage and bone, and this can be problematic because you can have decreased movement, decreased function, and also acute or chronic pain. Osteoarthritis can affect any joint in the body. In your upper extremities, it's very common to see osteoarthritis in your thumb base or in your fingers. So now let's get into some therapeutic treatments that you can do at home to manage your osteoarthritis in the hand. A very important technique to follow is joint protection. The principles under joint protection will allow you to continue performing your daily activities with the least amount of stress on your joints. Number one, respect the pain. Pain may not always be present during an activity, so just by being more aware of your positioning and how you're doing different activities can really make a difference. Once you do start feeling pain, you want to stop whatever activity it is that you're doing and just use different pain management techniques, which I will go into later in the video. Number two, use your larger and stronger joints instead of your smaller joints. Some examples include pushing the door open with your forearm instead of your fingers, or carrying a grocery bag on your shoulder instead of your hand. Number three, use a neutral thumb technique. As you can see in the picture, it's basically your thumb resting on your index finger. An example would be when you're texting. We tend to text with our thumbs, but instead you can use your index finger and your opposite hand to support it. Number four, avoid tight or extended gripping and pinching. Some examples include sliding objects on the table or building up your grip with foam tubing or a towel wrap. You can also use adaptive equipment. Number five, energy conservation techniques. A very important one is to ask for help. You can also alternate heavy activities with light activities. Take frequent rest breaks, if possible every 20 minutes. And of course, don't forget to schedule relaxing activities. Now let's go into some activities you can do at home to reduce your pain. Number one, heat. Heat increases circulation, reduces joint stiffness and soreness. You can use warm water soaks or a moist heat pack. For the moist heat pack, you can use a towel or a stockinette with rice or beans. You can warm each up for about 1 minute to 1.5 on the microwave. As you can see, this is what a stockinette with rice looks like. Please keep in mind that heat can actually worsen your inflammation if it's used inappropriately. You only want to use heat for about 10 to 20 minutes at a time. Do not want to use heat when you're having a flare-up. That's when you have red, swollen, or warm joints. Also want to avoid the possibility of burns and going to sleep with it. Number two, cold. Cold is great for reducing pain during acute inflammation, maybe from a flare-up or just from overdoing it. You can use a cool pack from the refrigerator. You can also do cool water soaks or even a pack of frozen veggies. And you want to make sure you do use a layer in between. If you are using cold, you want to make sure you do it for no more than 5 minutes. Do not use cold if you have cold intolerance or if you're sensitive to cold, or if you notice that the body part's already cold or pale. Number three, massage. You can use a lymphatic technique to reduce inflammation. By that I mean it's a sweeping motion towards your heart. Go from far away towards your heart. You can do this more global or more focal to the specific joint that's swollen. If you have thumb pain, you can actually massage the muscles around the thumb on both sides of the hand. And you can do this with or without lotion. Finally, we're going to go over some therapeutic exercises. These are a combination of flexibility and strengthening exercises to improve your movement, hand strength, and support your joints. Please be sure to check with your healthcare provider prior to starting an exercise program. These exercises should not cause you any pain. Make a fist, then straighten your fingers. Make a hook, then straighten your fingers. Bend your thumb across your palm, then bring your thumb back to the side of your hand with your thumb tip bent. Then straighten your thumb tip. Place the side of your hand on the table and move your thumb away from your hand, making an L shape. Place your palm on the table and move your thumb away from your hand. Bend your wrist forward and backward. Be sure to keep your fingers relaxed. Make a fist and hold for 10 seconds. If you didn't have pain with the previous exercise, you can use Theraputty. You're going to roll it up into a ball and squeeze for 10 seconds. Place the side of your hand on the table and move your thumb away from your hand. Use your opposite hand to resist your thumb and push it back towards your hand. Make sure you resist for 10 seconds. Place your palm on the table and move your thumb away from your hand. With your opposite hand, resist your thumb and push it back towards your hand. And hold this for 10 seconds. Move your thumb away from your hand and make a C shape. Hold this for 10 seconds. If you didn't have pain with the previous video, you can progress to using Theraputty. You can place it on the table and shape the putty into a square or a cube, just like this. Roll your hand into a fist and bring your thumb over your index finger, following a key pinch, and hold for 10 seconds. If you didn't have pain with the previous video, you can progress with Theraputty. You can roll the Theraputty into a log, then make a fist and perform a key pinch, just like this, for 10 seconds. Bring your thumb tip to your index fingertip and hold for 10 seconds. If you didn't have pain with the previous video, you can progress to Theraputty pinches. You're going to roll it into a log. Use your thumb tip and index finger to pinch the Theraputty for 10 seconds. Bring your thumb tip to your index and middle fingertip and hold for 10 seconds. If you didn't have pain with the previous video, you can progress the Theraputty and roll the putty into a log and use your thumb tip, index fingertip, and middle fingertip to pinch. You can do this for 10 seconds. Place your palm on the table and move your index finger away from your middle finger. With your opposite hand, resist your index finger, pushing it towards your middle finger. Do this for 10 seconds. If you would like to learn more treatments on how to manage your osteoarthritis in your upper extremities, please see an occupational therapist or hand therapist. Thank you for watching the video.